Students, till now we have learnt a whole thing about the reproduction in humans, right? So we studied the reproductive systems and how the gametes are formed, how exactly fertilization takes place, and how is the childbirth. Now, the major issues with respect to this is about the human child production, that is population explosion. Now, just in India we have 130 crores population. Imagine at one time, a time may come, we will have hardly 1 square foot of place for each human being. So why this is happening? This is mainly because of a lot of things. Actually, when they do census, they are identifying that population is more in the people who are illiterates. Those who are literates, those who are above the poverty line, there is no population problem. Why population explosion is happening? One reason may be due to improvement in medicines and improvement in the lifestyle, and everything is fine. That is about the advancement of science. But other side, why only population is increasing in such an alarming rate? Demography, you can get the straight line, is because of mainly illiteracy. So if this way it goes on increasing, where we will end with? So there is a immediate requirement to analyze this, why the population is increasing and how to educate people regarding this. Because you know, see, everything is increasing, and land rates are increasing, the people are not getting jobs, people are not getting right water, right food, to have shelter. Everything is not possible nowadays because there is a huge population. Everywhere there is competition. So for this population explosion, what are the side effects and why it happens? Mainly I told you 1 or 2 reasons. If they will ask you about the increase in human population, they may ask you the reasons for it. One may be the illiteracy. There are those who don't have knowledge at all about the population or how many children they have to have in a family. They don't have any idea about this. Then they don't even bother about why are these things are going wrong. They are becoming more and more under poor condition. They are in more poverty line. Just because there are a huge number of children in one family, you have 2 to 6 or 7 children, then if they are unable to feed them properly, then for them it is very difficult to manage the children, and how are they growing? The children which are more in number cannot get proper education, they cannot get the proper shelter, they cannot get proper food, drinking water, nothing will be available. So population explosion results in so many other things like air pollution, water pollution, everything is happening because everywhere they are living, right? They are making small slums and living, and everywhere there, if you educate them regarding this. Why? But thing is just education, not just learning the literacy about ABCD. You have to give them understanding what is the future problem if they are facing. If anybody, there are a lot of small units, they are going and educating them, but still it is not enough. But anyway, as students, you have to know this, that this is going to be a future big problem, right? So you understand, and that's the reason that is there in your chapter, population explosion and how to control population explosion. That is today's chapter 1 unit. This is about the reproductive health. Means if the reproduction is happening in such an alarming rate, how to maintain the reproductive health by having a healthy family, healthy group of children and healthy environment. That's reproductive health. Then what about the human population? How to control this? Those are the methods of birth control. So first unit I will explain you about the various methods of birth control, right? So what are the ways of birth control in humans? So what is this? It is about various methods of instruments or ways by which the number of offsprings produced per family is decreased. That's what we call the birth control. So how to control birth in humans? Those are various methods are there. So birth controlling methods are also called as contraceptive methods. Contraceptive methods refer to contraception refers to the opposite word for conception. To conceive is to become pregnant. Contraception is not to become pregnant. That is called contraceptive method. Contraception is avoiding pregnancy. So, birth control methods are called contraceptive methods also. Or we call them as family planning methods. Family planning methods. Okay. So let us learn about these various methods of birth control. Initially, I will just give you two divisions, two groups are there. Some are called temporary methods, some are called the permanent methods. So let me give you the first type of contraceptive methods as the temporary methods. Temporary methods. Okay. What are the temporary methods then? First, it is a very, from a long time the people are practicing. See, one more thing before we enter into this, what is the need for family planning? It is the planning the size of the family. That's the meaning of it. Means, if there is a family, husband and wife, they have to plan for the child, right? When they can afford a child, whether if they get a child, are they in a position to give the baby every facility every child needs? Like, can they educate the baby? Are they able to give it proper sophistication and educate the baby and give it proper food and water? This is the basic responsibility of every family member, mainly husband and wife. If the husband and wife both have to plan for the child, is family planning, right? Family planning has a slogan, having a child for choice, not for the chance. This is the family planning method. There is a slogan, that's a main theme of that, is having a baby or having a child for choice, not for the chance. Means they have to plan for the baby when they can afford the baby. Suppose they have already one child, then they have to think for the second baby whether the right time they are getting it or to have a baby, another baby, and whether the first child will take care of or it will accept the new baby. That time they have to plan for it, right? If they have already one child, imagine the baby is around 1 year old, they can't afford the next baby immediately. Why? Because immediately next baby, if it is born, then the first baby will get a kind of jealous or start competing with the newborn one. And most of the cases are there where the older one gets suppressed or depressed. That's why it is needed by the parent to understand the baby's psychology. Whether then the baby is accepting the new one or the already baby, which is around 1 or 2 year, 4 year, 5-year-old baby, if it is there, then it will happily enjoy the new child, which is a new person coming their home. It's like a doll for them for the baby to play with, right? Therefore, the parents have all this responsibility to look after their family. Therefore, they have to adopt certain scientific methodologies for planning their child, planning their family, or planning when to get conceived, whether they can give enough time to the child. Therefore, the methods are there. Anyway, you need to understand them thoroughly. Even this is a 5-mark question. Write a note on family planning methods or contraceptive methods for your board exams only. Right? So, let me begin with the types of methods of family planning. First one is for the temporary family planning method. So, what is meaning of temporary? It is not to be like, it's not a surgical, it is not permanent. Only at that time they can avoid the fertilization, avoid pregnancy. Is a temporary method. Under this we have types. Under this first one is called the natural family planning method. Natural methods, right? Natural method means there are some again types in which they can avoid the pregnancy. First one is called as in this the safe period method. Safe period method. So, what do you mean by safe period? So, let me explain you more. So, you all know that biologically, you already learned the biological thing when the females are undergoing the ovulation. Egg is released. If the menstrual cycle is of 28 days, then 14th day they may undergo the ovulation. If during that time the sperm fails to fertilize the egg, then that period it is saved from pregnancy. So this is following the same. It's a very old method followed by a lot of couples because it doesn't require anything. Only thing what you have to remember is, first after menstrual cycle 5 days bleeding happens, first week and the last week is considered the safe period. So the family or the parents have to understand that first 7 days or last 7 days are considered to be safe, and during them the intercourse can happen without having any probability of having the conception. But only the center part, that is 14th, if I say exactly 14th day only, it will not happen. So it has to start with around 13th or 12th day. 12th day to almost 17th or 18th day. So mid 1 week or 6 to 10 days are considered to be the danger periods, because during that ovulation is happening, egg is releasing. Therefore at this time it has to be, the intercourse should not happen. Therefore this is called the safe method, or following the safe method, right? This is one of the most popular natural family planning method. Okay, so then next one I will talk about some of the barriers, or we call them as mechanical barriers. Okay, mechanical way the sperm entry to the egg will be avoided. So what is the mechanical way? Just only is sperm should not enter into the egg, that's it. So there are various methods in this. First one is using the spermicidal gels, creams, etc. So before having the coitus or intercourse, the female has to apply certain spermicidal gels in her vagina, so that once the sperms are released, they will be attached to this and they get killed. Normally it is made up of some potassium permanganate and other chemicals, so sperms cannot survive in such chemicals. So this is one easy method. The second method in mechanical way of contraception is using of the condoms. This is second method, using the condoms. So condoms, again one more question they may ask you, what are condoms? Condoms are the thin, elastic, rubber-like, sac-like structures. They have to be rolled over the erected penis, so that during intercourse, although sperms are released, they will be trapped in the condom itself, so that the condom can be thrown later. So this is the safest method and most popular method. And this condoms which are very popularly available are Nirod. This actually our government will supply free of cost. Nirod will be available in government hospitals also. So this is the best way to avoid pregnancy. Even this is the only method by which you can avoid any sexually transmitting diseases like HIV, that is AIDS, or gonorrhea, or syphilis. These are all the diseases that are transmitted through the sexual fluids, mainly semen, or through the vaginal fluids. So once the condom is applied, then there will be mechanical separation of the fluids, due to which there is no chance of transfer of such diseases that are STDs, called as sexually transmitting diseases, right? So that's the second one. Third one under this is use of IUDs. What are IUDs? They are called Intrauterine Devices. Word you have to remember this. It is Intrauterine Devices. So IUDs are the intrauterine devices. These are certain instruments which are normally either made of metallic pieces actually, or sometimes nowadays plastic also they are using, but mainly metallic pieces. This is having one important property, that this will be inserted into the female uterine area near the cervix or next to that endometrium area into the uterus, so that egg will not undergo after fertilization. If fertilization happens also, there is no implantation, because if there is some foreign body present already in the uterus, then implantation will not take place, right? So this is an intrauterine device which is very common. 1 minute, you just go through this, just I'll explain you. Okay friends, I was talking about intrauterine devices. This is the third method of mechanical contraception. What is this? I told you, intrauterine devices are certain small instruments or certain objects that are made up of normally metal, and they have to be inserted into the uterine wall, almost in the endometrial tissue, so that this has to be done by doctors, right? It is not self-operated like how Nirod and all I told. This is all self-operating. But intrauterine devices are those devices that have to be inserted into the vagina, inside the vagina, into the uterine area, so that it will avoid implantation. Because if there is any foreign body already present in the uterine area, this will not allow the implantation to happen. And also immediately after the egg is released from the fallopian tube, it will go down into the uterus. That's how it will avoid pregnancy. So in intrauterine devices, there are very famous type of IUDs found. One is named as copper T, which is cheapest one, made up of copper. Then another one is Duncan sheath, and many other types of such intrauterine devices are available. And copper T is used very popularly or mostly because copper is a spermicide. It will kill the sperm. So once copper T, suppose imagine this is the drawing I am giving you. Okay, this is the uterus and here is the endometrial tissue, and copper T is inserted like this. Okay, like this, and it will be attached to this area. So although the egg will release and sperms are released, most of the time sperms released will be killed by this copper releasing thing, because copper T will release some kind of copper, and due to which the sperms are getting killed. And also the egg will not get fertilized. It may be fertilized also. The fertilization is different process. It happens in the fallopian tube, but after that it cannot get implanted. That's why the copper T and other IUDs are more safer. But this is very common. This is used only to bring the distance between two children. Means once they already have a baby, after the child is born, after the first baby is born, the doctors will insist the female to have a copper T by inserting. They will only insist them, so that once the copper T is inserted, the female cannot become pregnant. Moreover, if she is normally breastfeeding the baby, then naturally there is a family planning, but still avoiding the next pregnancy, this is the best method. This is a simple method and best method, but this has some kind of side effects, because sometimes this copper T may get moving some from here, it may have a jerk, go to some other place, and it may have some pain. Abdominal pain may happen. Sometimes it will be light discharge of blood also will be there. Therefore, there are little complaints, there are some complaints also, but still this is the most easily adaptable method for and guaranteed family planning method. Okay. So now these are the types of mechanical contraceptive methods. Mechanical is some mechanical thing is brought between the embryo sperm and the egg, or mechanically it is attached here so that the implantation will not happen. Now I will give you the next one, that is about the chemical methods. So chemical contraceptives, these are certain chemicals that are used to avoid pregnancy. Very simple ones are these, are the chemical ones are mainly the female pills. These are very popular ones. Female pills are very popular. They are made up of FSH and LH. They avoid the production of FSH and LH so that there will not be egg released. When they, like example, they will take example is Maladi. You have heard about Maladi. This is provided by Government of India. This will be available freely in the government hospitals also. If the female keep taking these tablets, she will not have ovulation. No ovulation, no pregnancy. Therefore, this is the daily pill. This is called the daily pill. because so many other pills are also there, but this is a daily pill. She has to consume it up to from the day when menstrual bleeding stops till the day she begins the next menstruation. So almost around 20 to 25 days she has to consume this tablet. This is called the Maladi. It is a very good female family planning or contraceptive pill. Another one available here, its name is Saheli. This is also developed by Government of India. This is a weekly pill. The female has to consume once in a week, so that it has its ability to act as contraceptive chemical for almost 1 week. Therefore, these are the two known methods of chemical methods of family planning, or the pills which are used by Indians for family planning. But don't consider in this I pill. I pill is not the family planning pill. Therefore, I pill will not come under this, because I pill is going to, suppose there is an intercourse happened, to avoid the ability of getting pregnant or to avoid the implantation, they will take it, but that is very harmful. It has a lot of side effects. Therefore, only these two pills are very popular in India, and this is asked many a times for Saheli. Which is from the Indian Drug Research Center only they have produced Saheli, a weekly pill for family planning. Right? Normal one, daily pill is Maladi. There are no male pills available as a family planning pills. Earlier they were available, but now they are very less popular because they were made up of the cotton seed oil. But that is not used anymore now, because the cotton seed oil reduces the sperm count also. It has a dark side effect. Therefore, male pills are not very popular and not good also. Right? Even using copper things also is not good. Right? But anyway, copper, it has spermicidal character. That's why I told you copper tea is used as a intrauterine device. So understand these are very important things for you. Right? 1 or 2 methods you can write, and these they will be asking you for 1 mark question also, 2 mark questions, or 3 mark, 5 mark. Right? Whether separately they will ask this or one they ask also, you should go through the details of this, and before start the question writing answers, you should write the need for population control. This is one of the control for population, method of population control. Then you have to give introduction, then start with this. Okay. Then after this, I'll just give you the surgical methods of family planning. Just write some points. Right? I'm making it a little simple. Right? Understand and make some points and be ready. I'll explain you. The next one is the permanent methods or surgical methods. Okay. Okay, now let me talk about the surgical methods of family planning, or we call them as the permanent methods. Permanent family planning methods. So these are, like you must be knowing, very popular there, right? One of them is tubectomy, another one is vasectomy. Tubectomy, this is one. Second one is vasectomy. So tubectomy is a surgical family planning method in females. This is the family planning method in males. Okay. Tubectomy, what they do is, suppose this is the uterus and this is the fallopian tube. Through surgery, normally through the laparoscope, means they will not even cut open the abdominal wall, only 2 stitches are made, the 2 small incisions are made on either side of the navel, and through laparoscope only they can view this, and if this is the long fallopian tube like this will be present, right? They will cut this in between and they will tie it back like this. This is the one they are tying, and this also they will tie. They will not cut and remove this totally. They will cut and tie this. Okay? Like this. Both the sides they will cut and tie the fallopian tube. This is the method which is very popular and it is easy also, right? Like this they will tie. This is called as tubectomy. That is, the fallopian tube is cut and tied back. So this is a permanent method, so surgical method, permanent method. So although egg is released from the ovary, imagine here is a ovary, graphene follicle releasing the egg. Egg has no way to get into the fallopian tube. Egg will come out, come may here, or it may be lost. That's how egg will not enter into the fallopian tube. There is no egg entering the fallopian tube. There is no question of fertilization, there is no question of implantation or pregnancy. So this is the permanent method. Earlier this method, they used to cut and remove the fallopian tubes. Nowadays they are tying it. Because suppose they have one child, they undergone the surgical, tubectomy. Then suppose they want another child, this can be reverted also. They can be opened and again they can join this. This is a new method in which tubectomy can be reversed also. Right? These questions you can get it in CET or NEET also, how tubectomy can be reversed, or which is the method in which reversing of the family planning can happen or the surgical method can happen. That is through in tubectomy this can be reversed. But main thing is this is the major method in which total family planning is done, total contraceptive method, it is a surgical method. Next comes vas deferens. Vas deferens already is in males, I told you. What happens here? If this is the testis, this is the epididymis, and you know that this is the vas deferens which goes around this, right? And this is what is forming the urethra, and this is the penis, right? I'll just give you the small details of this because you should understand this. Okay, this is the structure. Here they are not going to affect the testes. Testes will remain same, right? Most of them they have some lot of problems with this. Testes and all they will not cut open and remove it, right? This is epididymis. This is a vas deferens. Vas deferens is cut near the abdomen. Here is your abdominal area. They cut it here and tie it back, either this way or that way, right? Like this, it is cut and tied back. Okay? Now we got very simple meaning of this. So it is cut and vas deferens is cut and tied. It is through the small surgery. It's a very little thing has to be opened up and very small incision is made here and it can be cut and tied back. This is the one important method in which sperms, although they are released in the testes, pass to the vas deferens, they will not pass into the urethra. They will be stopped here only. Sperms, but otherwise here you have urinary bladder and seminal vesicle. So semen is released, everything is released. Semen is released, prostate is released, prostate gland secretions are released, bulbourethral glands, everything is released. But sperms are not there. Semen is released, and all the hormones are released, but not the sperms. Right? This is why I am telling this much in detail, because most of the men have the idea that this is going to affect their fertility. No way. It is having testis intact, sperm production will also happen, and even semen is released, ejaculation will happen, but ejaculatory fluid will not contain the sperms. Therefore, the vasectomy is going to be more easier surgical method compared to tubectomy, because tubectomy female has to get admitted and it has to be given anesthesia. She should be given anesthesia complete. 1 day she has to rest in the hospital. Anesthesia, local anesthesia is given to them. But in vasectomy, this is very simple. Just 15 minutes, this surgery is done and it is over. Again, sperms, although they are released, they will be lost in the body cavity. They will not pass through the urethra. Therefore, the more easier method among these two is vasectomy, not the tubectomy. Therefore, men has to be educated for vasectomy. There is nothing happening apart from not ability to pass the sperms through the urethra. Therefore, this is more safer method and it is less time consuming method. Right? So, therefore, in husband and wife, anybody can decide who can do it, but best is the men can do it, because women will have to have a lot of big things are happening. She has to take rest and all that will happen, right? Therefore, whatever I told you, education is nothing but not just learning the language and all. Apart from that, you should educate your psychology. Like you should understand, right? This is not something bad. You should understand this is what is happening, prevailing problem it is, right? Earlier and all till today, vasectomy if they are getting done, Most of the men will oppose this, but it is not right. So understand, this is a very simple method and easy way to avoid pregnancy, right? So these two you understand. Drawing just I given it because you should know where exactly they are doing it. So this contraceptive method will complete here. Only one more is there, that is the total. This is actually surgical method we call it. Total permanent surgical method is called the castration. Actually it will not come under this actually. It is not a family planning method. Castration is permanent loss of fertility. Castration is the removal of testes. Surgical removal of testes. This is a not actually method of contraception, right? Castration, they will do it if the testes are infected or they have some any other problems or cancerous tumors or something is that, then they do castration. Even in Klinefelter syndrome, those who are bisexuals, in them castration is done. This is another permanent method. Apart from this, another permanent method is hysterectomy. You would have heard about hysterectomy. Hysterectomy is the condition which uterus in the female is cut and surgically removed. This is normally done during around later age, or if there are any tumors or any cysts are present in the uterus, or female is approaching the menopause and she is having severe bleeding or hemorrhage, that time hysterectomy is diagnosed, or their guidelines are given by the doctors for the female to undergo hysterectomy. Once the uterus is removed, then females can be relaxing, because at the menopausal period, natural stop in the ovulation is not happening in recent years. Earlier they never used to do. But recently, after 50-55 plus, doing hysterectomy is helping them to remain healthy and avoiding overbleeding. Right? So these are the various methods of family planning. Understand them thoroughly, and these two we don't bring them under contraceptive methods, because they are the permanent method where the females can be sterilized or men can be sterilized. That is different. So these are the up to the vasectomy and tubectomy. You should learn them in detail. Okay, this is the major question for you. Write the note on family planning methods, or differentiate between vasectomy and tubectomy, or write a note on condoms, write a note on the temporary methods of family planning. All these can be expected. And one more thing is that is abortion is given to you MTP. That is the we are going to stop the or implanted baby will be aborted. That is MTP. This is actually not accepted. This is illegal according to Indian law. But abortion also sometimes the people prefer, but it is wrong to abort the baby after once it is implanted, embryo is developing. Before 3 months, because the trimester, the third month of pregnancy is called trimester, 6 months is called second trimester. Before first trimester, they may do it, abort it. But after that, it is very difficult and that may lead to certain complications. But anyway, that is MTP, or the abortion is also adopted, but this has to be avoided and it is illegal. Doctors should not conduct abortions. And third month, till third month it is okay, but after third month it is not accepted in Indian law. Therefore, abortion I have not given details of that. Right? So these are about the total story about the family planning methods. Understand and write down these whenever you are asking me about the notes. No notes, just keep them, pause them, go to the details in your books are there, and then understand what is there to be given. Understand, read them, make your own points, so that you will be able to write in examination. In like you get confidence also, right? Everything my words you are listening to me, reading also, watching the pictures. Then what you do is pause and take that word tubectomy. Observe in your any of this. Nowadays Google is available to see how tubectomy operation is conducted also. Because mostly after this, if at all you get through NEET medical, you will have to know all those things. So now only get knowledge. Getting the knowledge is very simple, easy. Nowadays everything is available on your fingertips. Right? So, and we have learned almost everything about the family planning and human reproduction, and you just watch extra things also. Don't just only think, okay, this much is there, this much I write 1 mark, 2 mark. No, extra things you learn, make points. So when we again meet, when the college starts, then I will see how many things you have new things you have adopted in your studies. Okay, so apart from this, you do some more work so that it will help you and your growth. Okay, right. After this, we will start with the next one, that is about the various methods in which the baby can be formed artificially if their couple are sterile. Right? That's artificial pregnancy methods. Okay, just go through them, read them. Okay, now students, we will continue with the reproductive health. Next is about the ability of a sterile or a couple who are unable to get children, and what are the medical techniques by which they can have a child. Right? So before anything, this is what we call the medical improvement or medically or artificial pregnancy methods. Before that, I will give you some more reverse way. Like till now we talked about the overpopulation, but I am talking now about those couples who are unable to produce children and remain as sterile because of sterility or because of so many reasons. They will not be in a position to produce a child. Right? So this is called as infertility. So let me give you something about infertility. Okay, what is the infertility? It is inability of a couple to produce a child although they are together with normal sexual intercourse for almost 1 year without following any contraceptive methods, without using any contraceptive methods. Then they are considered to be childless couple or they are sterile. Right? So what is infertility? One more question. It is inability of husband and wife to produce a child although they are together for 1 year having normal sexual intercourse but without using any contraceptive methods. Then they are considered to be the sterile couple. Right? So why exactly they will become infertile? Right? So infertility is measured in general. It may be with the men or with women. It's not that only female has to be given the credit that she is not able to produce. But so many times you have heard about this. The females are always say that she is not able to produce child, something is wrong with her. This is all our thinking. But actually, scientifically thinking, both men and women can be sterile. So many other reasons are there for this. One of the major reason in the city is overage. Means after 35 years of age, a female get married, her chances will drop to 20% only to have a child. Only female can be fertile in early 20s. She will be very fertile, she can produce healthy children. Then even men also, after certain age, around 40 plus and all, they will not be having, they may get some other problems. I will discuss those infertility problems now, by which they are not able to produce children. So first one, I will explain about the infertility in females. Actually, infertility we divide into two types. It may be a primary infertility or it may be a secondary infertility. What is primary infertility? This is the inability of a parent or the husband and wife to get the child even for the first time. There is no pregnancy at all in their whole lifetime after they are getting married or they are together for in one year, almost 1 year without having child. Not even once she has become pregnant. This is called primary fertility. Not even abortion has happened. Such condition is said to be primary fertility. There is something wrong with the female or male that has to be analyzed. But secondary fertility is once they are already she has a child. One child is there or she has become once pregnant. But later they are unable to get the pregnancy. She is unable to get conceived. This is called secondary fertility. So primary means in the whole the married life of being together, they are not able to produce a child. Not only that, she is not becoming pregnant at all. Right? This is called primary fertility. Secondary is after they already have one baby, then next they are not getting it because so many other problems. That is the secondary fertility. So let's begin with the female infertility problems. What are the problems with this? Female. First important problem is inability of the zygote to get implantation or implantation failure. Implantation fails. What is this implantation? The fertilized zygote or the blastocyst, once it comes to the uterus, it has to attach. But sometimes what happens is this attachment will not happen because uterine wall will reject this. There is a kind of incompatibility between the zygote and the endometrium tissue. So, although it gets fertilized, it may not implant, so that it will be rejected. So, once it is rejected, it is aborted. So, no question of pregnancy. This is one important reason, which is very internal reason. Hardly people will understand what's happening with this. Second reason or second way of infertility in females, their fallopian tubes are blocked. Fallopian tubes remain blocked. So why there is a blockage of fallopian tube? One of them is the fallopian tubes might be having some blood clots. During the menstruation will be bleeding. Sometimes blood clots will adhere to the fallopian tube and block it. So although egg is released, you can see here, suppose this is the uterus, okay? Fallopian tubes are here. Suppose they have clotting here. Although egg is released from the ovary, this will not be able to further move inside. This is called blockage in the fallopian tube. First one I said, implantation fails. Means fertilized egg will come also, it will not be, it will be rejected by this, so it will come down. This is the major reason. So fallopian tube blockage also causes infertility in females. Third one, there may be a type of any tumor or cysts developed in the wall of the endometrium. Something like this, a big tumor have developed, then there is no question of implantation at all. Therefore, if she has cancer or uterine tumors, then there is no question of fertility. They will become infertile. They cannot become pregnant. This is tumor or cyst. Or they may have polycystic ovary problem. Polycystic ovary, that is called PCOD. Polycystic ovarian disorder. That is a long form. Polycystic ovarian disorder. This is very common. You have seen, you have heard about that happening in all young girls also. They will be having polycystic ovary problem, due to which they become overweight and their menstrual cycle get disturbed. Right? Therefore, polycystic ovary problem have to be solved by doctors before they get total problems after marriage. Right? This is a polycystic ovarian disorder. Then other problems include hormonal imbalance. Hormonal imbalance, already I told you once, for menstruation also there are 4 hormones involved, 2 ovarian hormones, 2 are the pituitary hormones. Ovarian hormones like estrogen and progesterone, and the pituitary hormones like FSH and LH. If they are not produced in the right time, right way, then there will not be any pregnancy. They will suffer from sterility. So these are the major issues happening in females. And apart from that, they may have thyroid issues, thyroid problems like hypothyroidism actually leads to mostly sterility, and hyperthyroidism also. Mainly thyroid issues will cause the infertility. Then apart from that, there may be overaged. As I told you, overaged is a major issue. So if the age of the female crosses 35, percentage of fertilization reduces. This is a very important thing. But it's happening in a modern condition because females, if they are career oriented and all, it takes their time to study and then get into a job, stabilization of jobs and all. 35 they cross and get married, the percentage of fertility will reduce to just 20%. 40 is almost done. After 40, it's very difficult. But before also, 35 to 40 time also, it's only 20% fertility. So they are very, very fertile at the age in early 20s, right? 22, 23, 24, 25, they are fertile more. So that's the right age for the female to get married and produce a child, at least to produce child, right? So therefore, this is major problem happening in women who are mostly getting married at the older age, right? After 45, 40 plus and all, the ovary production or production of the ovules and all will reduce, the egg will be reduced and ovaries start getting contracted. Therefore, as early as 20 years plus, the getting married and getting child is more healthy for both the mother and the child, right? Then these are the major issues, and if they are overweight, that also is another issue in females. So all these are the female sterility problems or unable to produce child. These are the reasons in females. Okay, just note them down, because I see a lot of people will write so many unusual things and all. Write these things. It is a very proper way to write. Okay, these are the female infertility problems. Okay, now we'll move on to the infertility problems associated with men or males. Okay. What is that? Infertility in males. Why the males become infertile? Right? The major reasons, there are many reasons. Okay, males also will be sterile. There are a lot of reasons. One of the major reason is the low sperm count. Sperm count, as I told you, 4 million, it will not produce, it becomes very less. Then the chances of sperms, because almost so many are released, hardly 100 sperms will enter the fallopian tube. If the sperm production is low, then it is very difficult for them to fertilize the egg. Second is, this is called as oligospermia, that is low sperm count, or it is total no sperms at all, that is 0 sperms produced in the semen. 0 sperms is called as zoospermia, right? Oligospermia or zoospermia means there is no sperm at all in the semen. Second one, it is about the loss of motility. Sperm motility is low, right? So sperm motility also makes important point here. Sperm motility is if it is reduced, then also there is a problem for the men to remain fertile, right? Third one, it may be impotent. They may be impotent. See, impotency is for so many reasons they call impotent. One of the major reasons they are called impotent because they may have some erectile dysfunction of penis. Very important word I am using, erectile dysfunctioning, erection dysfunction. Normally men during the sexual intercourse there should be erection of the penis should happen. If that is not happening, that is going to cause impotency. So erection will not happen because of so many reasons, right? Overaged, psychological, depressed, most of them they think that psychological. This is mainly psychological, but not always psychological. Psychology is one of them involved, but sometimes it may be due to the blood clots. Blood clots will be there in the tubule, that is a vas deferens, vas deferentia, or the genital duct, everywhere. There may be infection of the bacteria or viral infection, or sometimes sexually transmitting diseases. All of them they may cause impotency, erectile dysfunction. Then fourth one, another one, it may be associated with this, having diabetes. Diabetes is one more cause for impotency, right? Sexually transmitting disease and diabetes, right? Then next one is if they are too much smokers, or they are alcoholics, or they are drug addicts, they are going to suffer from infertility, right? So mostly you would have heard about the younger generation going for all this smoking and alcoholism and all. This will affect their personal life at the later stages, right? Because right now when they are young and they are in adolescent age, they hardly listen to anybody. Once they understand the future is spoiled, that time it becomes irreparable. So at the earlier age, practice healthy ones like getting up and exercising and drinking and eating proper food, drinking good water. Everything will make your body healthy, and think positively, right? These are, I told you, erection dysfunctioning, and some of these are psychological problems they are, right? Therefore, as much as possible, be positive, think positive, and be healthy. Always keep doing exercise, right? So this is one of the important type. There are different types of infertility in men. Okay, so now if these are the infertility problems, nowadays you must not have to worry. Very important. Why? It's very important not to worry about, because there are a lot of new technologies have come to overcome infertility to produce children. That is the medical assisted pregnancies, right? Means doctors will assist in becoming pregnant. Like new methodologies are there with which the female can get pregnant and produce child, although she is not able to conceive in a natural method. So I am going to talk about those medically assisted pregnancy methods. Okay, so just note them down. Let's now go to the next one. Okay, so let's talk about medical assisted pregnancy or assisted pregnancies. Okay, now what is medically assisted pregnancy? Medically assisted pregnancy, or because assisted, are various methods by which doctors will help in making the female fertile or make the female to get pregnant, right? So first thing, if they are already sterile, they'll give various medicines for making them fertile, or if the sperm count is low, certain chemicals or certain medications are given, some hormonal treatments are given, so that the woman, if she is not producing egg also, she may start producing egg through various medications. Now there are pakka 100% methods by which they introduce the sperm into the egg so that she will become pregnant. So first method is artificial insemination. Artificial insemination. This is the AI, artificial insemination. Right? What is artificial insemination? Here the semen is collected and then introduced into the female genital tract artificially. This is the simple method to be conducted. Then, as I explained you already, various ways in which men and women may become sterile. There are new methods through medical way that they can get or overcome the sterility. What are those methods? That I'll explain you. Now, one of them, it's called a medically assisted pregnancy. Means if the couple are unable to produce children, then in hospital some doctors will assist them to become or female to get conceived. This is also called as ART. That is, ART is artificial reproductive techniques. Right? How artificially this can be assisted to get her conceived. What are that? First one is called artificial insemination, AI. This is a method in which the semen is extracted from the father, and it is actually, they will transfer the whole semen along the sperms to the female genital tract almost near the cervix, so that sperms will move towards the fallopian tube. This is again a chance, but at least one way it can be, up to one area it can be transferred. That is called artificial insemination. Second one, it is the other method, we call it as GIFT. It is called gamete intrafallopian transfer. Intrafallopian transfer. That is, the gametes, means the semen is collected, and in females the ovulation is improved by injecting FSH hormone so that more eggs are produced. Both eggs are extracted, eggs and sperms are extracted, eggs from the female, men from the men, sperm is extracted and into the fallopian directly they are transferred, so that the fertilization happens in the fallopian tube and this becomes zygote and there should be implantation and pregnancy. This is also a good method in which there are cases in which they have got positive results. Third one, it is called ZIFT. ZIFT is nothing but zygote intrafallopian transfer. This is zygote intrafallopian transfer. They will ask you for this, what is the long form of GIFT or ZIFT, they will ask you, or AI. So what is zygote intrafallopian transfer? It is slightly more in depth. The eggs are collected from the mother or the female and they are transferred to the artificial culturing media, which is in the controlled lab environment, and then sperm from the male are collected and they are transferred to the eggs, so that fertilization happens in the lab condition. Once zygote is formed, it is immediately transferred to the female genital tract, normally for the that is into the fallopian tube, because it is the intrafallopian transfer. Zygote is transferred to the fallopian tube so that it can get implanted on its own naturally and then conceived. That is a natural way. Half the way they are assisting it. Then the last one, but very positive results we are getting it from this, is the test tube babies. So test tube baby was, it's biologically called in vitro fertilization and embryo transfer. Okay, let me explain you this in detail. This is actually test tube baby. Most of them they think that baby is produced in the test tube. No, here the fertilization is happening in the lab conditions in the test tube. Then after fertilization happens, the completely 32 cell stage embryo is transferred to the mother's uterus for implantation. This was first done by the scientist Patrick Steptoe, and they produced the first test tube baby, that is a girl baby, that is the Louis Brown. This is the female baby. First formed test tube baby is Louis Brown, right? Even in India also they are produced, that is in Calcutta they produced another test tube baby, but recently. But first test tube baby was formed was Louis Brown. Now how they do this? The technique is little in depth. I am going to explain you. First, females are given with some FSH hormone so that she will produce more eggs instead of one egg. Then eggs are collected through the suction tube from the fallopian, directly from the through laparoscope. We just take it out. Then eggs are transferred to the artificial culturing media in the lab conditions with the controlled temperature and pH. They are transferred to that. Then once the eggs are transferred, then from the male, the husband, they collect the sperms, they put it on the eggs. Then fertilization, or they select the good sperms and transfer to it so that the fertilization happens in the test tube or in the petri dish. Therefore, it is called a test tube baby. Otherwise, it actually can be called petri dish baby also. Anyway, in that they allow it to fertilize, and then they transfer the fertilized zygote to another culture media so that it start division. They stimulate the divisions so that cleavage takes place. At 32 cell stage of cleavage, they take out the embryo and transfer to the mother's uterus so that she will have the normal implantation and become further growth or the gestation happens in the mother's womb. This is what is the technique of test tube baby. Then the baby can be taken out by artificially by cesarean. Right? This is the test tube baby formation, and it is very popular and it is giving 100% positive results. Right? But here there is some problem. What is the problem? Up to certain stage, embryo is outside the female body. The safest place for the baby is mother's womb only. But as the fertilization happens in the lab condition and up to 32 cell stage embryo is outside, there are chances that there may be any infections or radiation, something may happen, a mutation may happen. After transferring, there may be defective child formed. That's the only thing. But normally during the test tube baby or IVF refers to in vitro fertilization. IVF it is. IVF, in vitro fertilization and embryo transfer. In vitro means in the lab fertilization takes place. Embryo is transferred. Embryo is transferred to the mother's womb for the further development. So IVF ET they will ask you the long form. In vitro fertilization and embryo transfer. Embryo transfer. So this is the very modern method and this is working also well, and they are giving guaranteed babies are formed here. But normally in test tube babies 1 or 2 or 3 embryos they will transfer for implantation. Therefore there is a chance that multiple children or normally it may be twins or triplets or quadruplets are formed in this. But anyway, this is a good method in which the couple are satisfied as they are producing the children even at the older age, right? This is how medical things have advanced. Now there is no issues. And one more thing is a very nice thing is intracytoplasmic injection, right? This is one more thing, intracytoplasmic injection. This is also one guaranteed method. What they do is, if this is egg, then this is the vitella, this is the zona pellucida. They take the sperms through the injection tube and they will directly insert this sperm into this. This is intracytoplasmic injection. Into the cytoplasm they inject the sperm. That is 100% guaranteed method. But anyway, nowadays these are all available new methods in which it is called artificial reproductive technology or techniques are there by which the couple having no child or childless couple can get a happily one baby or 2 babies with respect to the requirement. So that's why the science advancement, how much it is useful for the mankind. You can get an example like this and understand this test tube baby production and all. It may be a 2-mark question procedure, or what are these GIFT, ZIFT and AI they may ask you. So understand this, and it's simple to write also compared to the other parts what we have learned in the depth of the drawing and all. There is nothing, only the description. Understand thoroughly, then you can reproduce or write it very easily, right? So let us, after this we will go to sexually transmitting diseases and end this chapter. Okay. Now the last part of reproductive health, that is the sexually transmitting diseases. Actually the whole aim of studying reproductive health is to how to maintain health of reproductive system, right? Actually these kind of classes have to be conducted to every student who is, or every child who is in the adolescent age from 10 years plus. No? We have to educate the children about the sexual problems and hygiene during menstruation and their oral hygiene, their pelvic hygiene. This has to be taught, right? This is very much essential for everybody to understand, the common children, and parents have to guide the children how to maintain the hygiene in their sexual health and their pelvic health and all this, right? So therefore the reproductive health chapter itself is like commonly everybody should understand it, right? So coming to this, I am going to talk about the diseases caused due to sexual intercourse with the infected person, right? They are called sexually transmitting diseases, or in short we call the STDs. STD is nothing but the sexually transmitting diseases. Transmitting diseases. Okay. So what are these diseases? So very important you should know is, these are the diseases mainly that are transmitted through sexual intercourse with the infected person, right? So this is a very major important thing to understand, right? No way, but there are some diseases in this like HIV or AIDS transmits through the blood also, blood transmission or serum transmission or all that. But major transmission is through only sexual fluids, vaginal fluids and the semen, it is transmitted. Therefore the name is sexually transmitting diseases, or we also call them as VDs or venereal diseases, right? So what you have to understand is these are the diseases which are very much problematic to both men and women because they need to be treated with strong antibiotics at the very early age, early time. When it starts only, they should go to the hospital. But the problem with the patients who are having diseases, they will not go to or visit doctors because major cause for sexually transmitting diseases is having multiple partners, means having sex with many people, and having many people sex with many people with oral sex, anal sex or vaginal sex, all the three ways it may get, or sometimes having sex with men also it will happen, right? So therefore these kind of diseases, to talk to people they feel very uncomfortable to talk, and even to go to hospital they will delay it, so that the disease will get very fastly progress, it may lead to death of the person. Therefore it has to be initially diagnosed. Before that you should have a knowledge about this, right? Having knowledge is always better, right? Therefore understand them thoroughly because they are going to cause so bad symptoms that if you see any pictures, if you get a time, you can just watch the pictures of these diseases I am writing. They are so worst that you will feel that okay, such diseases are so bad, almost like equal to death. It's like big painful disorders, right? So therefore understand that these are going to really make your life hell. Therefore avoiding having multiple partners, sex with multiple partners, or avoiding anybody who is having diseases to have sex with them, or avoiding sex with the homosexuality. All these things are very important to maintain sexual hygiene. Having single partner is very important, right? Now we'll go to the diseases, and once I start talking about the disease, it becomes so bad that you feel that it's so bad kind of symptoms they have, right? So let's begin with the first disease. It's a syphilis. Syphilis or syphilis. It is actually called the French pox also. There is another name for this is the French pox. Why it is called French pox? Because it has entered British people, England people from France, right? Those who entered from the France, they developed the disease or they spread the disease, right? And this disease is caused by the bacteria called Treponema pallidum. This name will be asked. Treponema pallidum is a causal organism. That's a bacteria that cause syphilis is Treponema pallidum. Understand by heart this name, and you have to separately label, underline them because it is a rule for labeling the binomial nomenclature rule it is. Therefore you have to label them, underline them separately, genus and species. Genus is Treponema, species is pallidum, right? Now what is syphilis problem? Syphilis is a disease which is called as a kind of serial disorder, means it will affect the humans in 3 stages. First is the primary stage, next is the secondary stage, then is the tertiary stage. Very bad it is. Like how it happens? If a person who is healthy, if he have the sexual intercourse with the infected person, then immediately within 1 or 2 days he starts showing the symptoms that are called primary symptoms. Small lesions are developed. On the penis, small lesions is reddish patches will develop. These reddish patches are developed even in the females on the vagina or surrounding the vagina, or even in the eggs area, anal region also they develop. And later this area becomes somewhat cankers develop. There are something called the painless cankers develop. Painless cankers. Not cancer, it is a canker. Canker is somewhat wart-like thing. There will be outgrowths present and all around the vagina small warts like thing develop, and they don't pain also. If they touched, nothing happens. Even men around the penis or on the testicles, you find small such cankers develop. Right? This is the first symptom. Primary symptom, there is no much problem and they will be having normal life and it may disappear on its own. Then after some time, it may reappear in the age of after few months or 1 year, it may reappear again. That is a secondary infection. During secondary infection, normally all over the body some kind of openings will happen, the bleeding will happen all over here, small lesions develop, mainly around the vagina and in the lip area. There will be opening cuts formed. All over the body, the bleeding and pus filled cuts are formed. That is an indication that even in their palms and their fingers and between the fingers, some pus like things will develop. This is the indication that this has entered the secondary level or secondary infection is started. Right? This at this age they have to treat it with strong antibiotics like penicillin, benzene penicillin they call it. It's a strong penicillin. They have to treat it. Right? After that, few months they suffer with the fever, headache and continuous infected pus and all. They will continue for few months and again they disappears. So the person may feel he has become normal. But the third symptom starts and the tertiary infections will start after 1 year or 2 years or some later stage. During then, the heart valves are totally destroyed by this bacteria. It is internally multiplying. Inside the coelomic fluid it will multiply and complete heart valves are destroyed and some of the meningeal area, the brain membranes are actually taken away and also liver is affected. That is the last stage where they will be having major issues and they will have Alzheimer's, they will have dementia, they will have heart problems, they will get the liver diseases, everything will happen and that may lead to death. And remember, this is nothing than like hell, right? Therefore, it's a worst disease. That is about the disease syphilis. And one more thing is syphilis disease, women will produce a child containing a problem called Hutchinson's teeth. See this word, you remember, I have given some extra thing for you. What is Hutchinson's teeth? The baby when it is produced, it will be normal with the milk teeth. But once they are replaced with the permanent teeth, then their incisors, the front teeth will become somewhat triangle shape and with a big distance, right? So if you observe the mouth, if this is the mouth, then you will get incisors here, right? You will get 1, 2, 3, 4 incisors. These will become triangle, like this it will happen, right? This is called Hutchinson's teeth disorder. This indicates that mother has syphilis, baby also develop it. The first indication is the permanent tooth having Hutchinson's teeth having triangle shape or club shape with a big distance between them. That's an indication. See, understand? They are not very simple diseases, right? Now, let's talk about the gonorrhea. Second disease is gonorrhea. It is caused by ROEA. Gonorrhea, right? Gonorrhea is caused by the causal organism, is a bacteria. Its name is Neisseria gonorrhoeae. Neisseria gonorrhoeae. This is also very common actually. In the whole of world population, almost 20% of people are suffering from syphilis and 120% of people are suffering from the gonorrhea. And mostly it is mostly common in America and other countries where there is a free sexuality, right? There is no restriction about having sex with anybody. That's the reason where these areas are mostly affected. Almost 120% of people are getting the disease like gonorrhea. Therefore, you have to understand it thoroughly. Gonorrhea is caused by the bacteria called Neisseria gonorrhoeae. Then what is the characteristic of Neisseria gonorrhoeae? Again, the symptoms start between 6 to 7 days after having the intercourse with the infected person. It transmits through the semen and through the vaginal fluids. So after 6 to 7 days, they develop a kind of pus-like secretion from the sexual organs. Like females from the vagina, they start producing a kind of pus-like thing from their vagina. It's a exudation, right? And it will be very sticky. We call that as gleat. Gleat is a pus-like fluid released from the vagina in females, even from the males. In males, through the penis, this is released. It is a one kind of sticky fluid produced, and it is very painful when it is released. Then, apart from that, females develop the complete infection all around the vagina. Not only that, even through to the anus it will spread, even to the rectum it will go to the complete internal tract, the reproductive tract and the urinary tract it will enter. That's why they will get painful urination, frequency of urination will increase. While passing urine, there will be burning sensation. Then they will have continuous joint pain and like arthritis pain, and they will have high fever, and the lymph nodes will swell. Normally in the armpits the swelling will happen, and there will be continuous pain in the armpits and the groin. This is for a long time. Initial stage, they should take antibiotics like penicillin. It can work initial stage. Otherwise later it will be almost they will have to survive with that. Right? Now, these are the two important diseases I spoke. Apart from that, there are some more diseases. The third one I am talking about is AIDS. AIDS is caused by the virus HIV, human immunodeficiency virus. So how it is? You know already viral diseases are so problematic because HIV is like, it was very popular among all the people because it is a disease which has no medicine. Right now there is a big viral disease which is happening, that is corona, which is due to mucus, that is different. But I am talking about HIV. It is a very serious disorder. It will affect your immune system. Virus affects your lymphocytes, B lymphocytes, the T lymphocytes mainly it affect helper T cells, which actually help in production of antibodies against the other diseases. If the pathogen enters in your body, our lymphocytes will recognize this and produce antibodies. That is the B lymphocytes, which will be helped by T lymphocytes called helper T cells. This will affect the helper T cells only. Therefore, the helper T cells will get changed by the defective HIV, due to which now all that the overall clones are produced of the T lymphocytes are all defective. The patient will not be in a position to develop immunity against any other pathogen that are entering. That's why it's called human immunodeficiency. Immunodeficiency happens. Acquired immunodeficiency syndrome is acquired because of the infection transmitted through sexual transfer, and it is immunity is going wrong. Therefore, the person who is having AIDS will have no special symptoms rather than any other disease, like they have diarrhea. They get through the diarrhea through the bacteria. Then our body will not resist that bacteria that is causing diarrhea. Instead, that start happily multiplying in our body because our immune system has gone wrong. And if you develop cough or cold, fever, that continues for like a lifelong disease. Therefore, acquired AIDS patients will get the disease permanently for the whole life. So they will have a huge problem, like all the immunity is gone wrong, their lymph nodes are swollen, joints are paining, their body is paining, and they will have continuous fever, there will be weight reduction. At the last stages, almost 1 to 5 years they will survive. At the last stages, they will be left with only bone and the skin. Right? That's a very worst disease. If at all you have seen any patients like that, you Google it and find out the pictures of them. Then you will get seriousness how bad is this disease. Most of the time they are talking like laughing and cutting jokes on AIDS. No, it's not a disease. Any diseases, if you make cutting jokes is not right, because it's science. Learn the science, understand how patients are suffering. Right? It is the real pain. The patients will, they have shared also how they will get problems and all. So better you go through them, be serious about all this. Not like a way, very happily talking about something like cold cough. No, it is real problematic diseases they are. Therefore, understand. Apart from that, you would have heard about some more disease. The fourth disease I will explain you, that is called chlamydiasis. chlamydiasis is caused by the bacteria. Again, it is common in most of the it's also sexually transmitted diseases, and it is having the problem with pain all over the body. There are small lesions formed, chlamydiasis, and they develop something like a warts on the body. Warts, and they are painless warts. Then next one is the disease which is caused due to virus. That's called human papilloma virus. So HPV, human papilloma virus diseases. This is actually, you have to be very careful. It comes in directly contact with the skin to skin transmission also. Close contact with the skin to skin also it will transmit, and other thing is mainly the sexual fluids will transmit. Human papilloma virus, it is also very dangerous virus which will transfer through the sexual fluids and cause a lot of other problems. The females will get high urination, heavy bleeding, and the problem with getting pregnant and problem with having the deceased child, even like HIV, it will be transmitted through the deceased mother to the child. And nowadays Government of India and overall throughout the world, HPV vaccines are available. The girls of the age from 12 plus, they should be given with this injection. In government hospital they will give it free of cost, so that HPV vaccination is like almost everybody gets it. Vaccinating the body is always better than having the disease and curing it. Mostly viral diseases are not curable, right? Therefore better you get vaccinated. It's like you should spread this information among the girls that this can be given. They have to take this injections. Human papilloma virus vaccinations are available in the market, or in the good hospitals also can go and get the injection. So that is like a vaccination for the whole lifetime, right? Now, including AIDS. The transmission of AIDS is slightly different. I told you the AIDS transmission is through the sexual transmission or through the blood transfusion, and using or sharing the blades, shaving blades and other things. So many times the shaving blades are shared between 2-3 people, and using the needles, common unsterilized needles also cause the disease. Therefore, and even drug addiction, they will not know what kind of needle it is, they may inject it. Therefore, most of the diseases are transmitted through blood also, right? Now, let me give you the overall prevention, right? All the sexually transmitting diseases can be prevented by avoiding multiple sex with multiple partners. Having sex with multiple partners is the only one idea by which this can be avoided. Using the condoms, it will avoid around 60 to 70% of sexually transmitting diseases. Then apart from that, there is another problem. Another way you can avoid it is having single partner, right? Having sex with a single partner, right? And avoiding sex with the infected person. That's another one. Infected person, because some of the diseases are non-symptomatic. The person will not show any symptoms, but still he will have diseases. That time it may affect the healthy person also. So avoiding sex with the infected person and maintaining sexual hygiene. And first of all, and last thing is, understand these problems and learn about it and give people knowledge about this. That's very important for you, because most of us, if you know, hardly we discuss with anybody thinking that this is something bad thing. No, having the right knowledge of science to every person is very important. This is what is education. Education, not reading and writing, but spreading positivity in everybody and understanding the major problems of the world, social problems, and give them some knowledge about these diseases and try to make them understand how they spread and give them how to prevent. One more prevention has to be done, that is to avoiding the, the prostitution, which is prostitutes will have multiple sexes, they will have this. So avoid all those things to have a healthy world. So this health is very important, because hardly parents and others discuss with their children about all these problems. So therefore, learn it scientifically, understand the science behind it, and be healthy, be positive. Okay, this ends the chapter reproductive health. Then this is the end of two things, that is reproduction in humans, reproductive health. Okay, so we'll meet in the other classes with some questions and answers and for the new chapter. Okay, done. All the best.